So, you're here because you've been referred to us for the inflammation in your eyes, a condition we call uveitis. But first, let's take a look at some of the structures of your eye that are involved in uveitis. Here is a side view of the eye. At the front, we have the iris, the colored part of the eye. The back of the eye has three important layers: the sclera, the white part of the eye, the choroid, which supplies blood to the eye, and the retina, the light-sensitive part of the eye. These layers collect light and send the visual information through the optic nerve, which is a kind of wire that carries signals to the brain to create the images that we see. When some of these small structures in your eye becomes inflamed, it can cause various symptoms, and this is what we call uveitis. With uveitis, you may experience red and teary eyes, pain, and light sensitivity. You may also experience changes in your vision, such as the appearance of floaters or cells, flashes of light, and blurry vision. An analogy that may help is to think of your eye as a house on fire, inflamed if you will. We might not know where or how it started, but our job is to find that out and help put it out. There are three main causes of uveitis: infectious, non-infectious, and sometimes the cause is unknown, which we would call idiopathic. Infectious uveitis is typically due to bacterial or viral infections. Common examples include shingles, syphilis, and tuberculosis. Non-infectious uveitis, on the other hand, is not caused by infection. Instead, it often stems from inflammation elsewhere in the body, frequently linked to autoimmune diseases. Some conditions associated with non-infectious uveitis include rheumatoid arthritis, psoriasis, Crohn's disease, multiple sclerosis, sarcoidosis, and Behçet's disease. Because uveitis can have different causes, we may need to do a few tests to understand what's going on. These might include neural imaging such as CT or MRI scan, blood tests to look for signs of infection or autoimmune markers, AC-tap or eye fluid sampling, where we take a tiny sample of fluid from your eye, fluorescent angiography, which uses a special camera and some dyes to see blood flow in the back of the eye. This is typically done at the eye hospital. And finally, genetic testing to see if you have genes linked to uveitis. When we rule out all possible causes through these workups, we call it idiopathic uveitis. In fact, 30 to 50% of cases of uveitis are idiopathic. Just like putting out a fire, our first priority with uveitis is to control the inflammation and set a fire prevention plan. In uveitis treatment, this means reducing inflammation and preventing future flare-ups. Remember, each flare-up carries a risk of permanent eye damage, which may lead to vision loss. Our ultimate goal is to achieve and maintain zero inflammation. Treatment for your uveitis depends on the cause of it. If a bacteria or virus is causing it, we'll prescribe antibiotics or antivirals. To control inflammation, we use anti-inflammatory medications like corticosteroids. These medications can come in various forms such as eye drops, topical ointments, oral medications, or injections. Please keep in mind that if your uveitis is linked to another condition or autoimmune disease, we need to treat the root cause on top of managing your eye health. We may need to refer you to other specialists and work closely with them to address the underlying issue and solve this big puzzle. Uveitis isn't something we can resolve immediately, and we might not have all the answers today about how long recovery will take. but please know that we'll closely monitor your progress and adjust your treatment plan to meet your needs. Follow-up appointments are important so we can keep track of your progress and make adjustments as needed. So, let's recap what we covered today. First, we explored the anatomy of the eye, taking a closer look at what uveitis is, along with its symptoms and causes. Then, we reviewed the various evaluations and treatment options available. Finally, we discussed what your journey with us will look like. Thank you for watching, and we're here to support you at every step of this journey.